guys, you're watching the girls here on SSP TV, ssptv.com, and the app SSP TV.
And you're watching us everywhere.
You're watching us everywhere. So today we're here and we're back at the Laurel Mall location. We've been taping a lot in this location, and we have a lot of great guests with us, and we're talking about some items that we use or that we see on some ads on Facebook and Instagram, and we are interactive, going live on Facebook. I was brushing my teeth a couple weeks ago.
What is that? Charcoal.
Facebook. I was seeing this and I thought this was crazy, a crazy ad, that it was just a hoax. You see a girl and it's exaggerated. She's brushing her teeth with toothpaste, and the toothpaste is actually black, and it's supposed to help make your teeth whiter. Now I will say this, I had my teeth professionally whitened 2 years ago, so that does play a role in it. But I drink a lot of coffee and a lot of red wine, so your teeth do get stained. So I wanted to try it, and it's called Cocoa Smile. This one is the charcoal advanced whitening toothpaste. So if you go on our Facebook page, the girls SSP TV, you'll see it. But I'm not going to brush my teeth here.
Oh,
but
rats! I wish you were.
See it. Now look at that, it's black.
So now when you brush your teeth,
it smells so good though. It smells like mint, and you brush your teeth. It's supposed to lather. It doesn't lather that good, but you brush your teeth for 2 minutes, and if you do it twice a day, it's supposed to help with whitening your teeth. So I don't know if there's a chemical in there or something, but the response that we got from the Facebook was like everyone that used it was amazed with it. One good comment was, your teeth are already white. Try it on someone who has stained teeth. And I said that in the Facebook post was, maybe if you smoke, or if you have like a stained, a colored tooth, or one color.
Well, did you see the demo? Did they do it on someone who had?
I mean, they just brushed their teeth, and of course it looks amazing because everything's edited. And ours wasn't edited, it was the real deal. So anyway, I would say, like, for me, no, because I don't have a lot of stains on my teeth. But I'll finish it because it was expensive. I forget how much it was, but it wasn't like your regular $1.49 or $2.50.
I pay $5 for toothpaste. So
okay, it was more than that. Okay. It was more than that, I believe. But if you have stains on your teeth, you might want to use this.
All right, I have something that works really, really well.
We're talking about eyeballs today, but I want to talk about teeth too.
Yeah, you also asked a question on Facebook about some what you remove your eye makeup with, which prompted me to start thinking about the eyes. And so when I went to my eye doctor for my last visit, I was given something because I have something called dry eye. And for years I was trying to use the drops and whatever the medication, and they always would sting my eye to a point where I would actually get pain in my eye. So I was unable to use the eye drops that were prescribed for me, which would help with the dry eye. So I suffer from the dry eye. I wear contact lenses. I didn't have good vision because of that reason, because you need moisture in your eyes. So I was constantly changing my contacts in order to get like that real fresh contact feeling. But anyhow, so I was given this device, and we're going to meet the doctor later, which is great. Now, what do you think this is? What do you think you're supposed to do with this? What are you supposed to do with this?
Do you really want to?
It looks kind of like from out of this world, doesn't it? It looks like a little alien with a little antenna. And so it's called True Tears.
You stick it up your nose, right?
You do. You stick it up your nose. Do you want to stick it up your nose?
I don't want to stick anything up my nose right now.
Maybe later on we're going to get a fresh one, because the tips are removable. You could put a fresh tip on it. But anyhow, I think it's like a little ultrasound. It's
not an anal thermometer, right?
And you're able to turn it on, and watch the cute little dots over here to turn it on. And then you can press to whichever desired strength you want. You always start out with the first strength. We will have the professional demonstration of this later. But you know what? I put this in as the doctor prescribed for me to do it in the office, and upon holding it in my nostrils for about 30 seconds, my eyes are producing their own tears. And what it does is it works on the trigeminal nerve up in the nasal passage, and it sort of like wakes that nerve up so that it'll start making its own tears. So not only did it do that, but afterward I'm like, well, I need a tissue now. Sometimes I sneeze when I do it, but I did need a tissue just because my nose was running. It opened my sinuses, Janine.
That's cool.
So everybody who lives here has bad sinus. Maybe because we're all teared up, and my eyes were overflowing with tears from them not going down the tear ducts. but from the cold. Anyhow, from
We're gonna
heat,
talk
cold,
about
in
that.
the summer, we're going to get the
Nice.
full demonstration, the full scoop on where you can get one of these as well. It comes in a cute little case. It has a little charger for it. It is rechargeable.
Okay.
And as I said, the tips are replaceable. And then I was also given some great eye drops to soothe my eyes. And with a special little drop of medication, which Doc will tell you about later, Dr. James Deom, who I'm speaking about. And it helped with, you know, when you have all your makeup on, your eyes look great, but they're all red. People ask me, what color are your eyes? And I always say red, white, and blue, because my eyes are always red, and my eyes are blue, and then I have like a little tiny bit of white, so I have like the American eye, because they're red, white, blue.
Are there
but
like
anyhow, with
stars
these
and stripes
drops,
in there too,
look at how
or-
white my eyes are.
I never had I don't have problems with my eyes. And I said, if you want 20/20 vision, don't go to the doctors.
Why?
No, I have to go because I take care of the kids and they get their eyes checked. I have no problems with my vision.
Well, that's great. So you don't wear contacts, but you do wear eye makeup.
I do wear makeup, clearly, and I don't have problems with the whites of my eyes. So my eyes are fine.
Well, you're very lucky you have
But I
tears,
need
but
to
I
go
am a
to
little older.
We're making an appointment live with Dr. Deom. Please make your eye appointments because we're joking about it, but you really should get your eyes checked at least once or twice a year.
I'm not joking about it. My eyes are very precious to me. I value my vision. I go for my checkups very often. The contacts I wear, you could actually wear for 2 weeks. I only wear them for 1 week. And I ditch them. And if my eyes feel a little gritty, I just ditch whatever they are and I wear a new pair anyhow because my eyes are so precious. I want to be able to see.
I know we have to go to break,
So-
but we had the product and we did, I showed a little Facebook between some of the products. What do you use to remove your makeup on your eyes? I use this one by Dermalogica, and so do you. It's a gel. It works awesome. I don't sell it, so it's not a testimonial. It's something that actually does work.
Right.
And so we use this, and then there were some wipes there. So Dr. Deom can talk about what to use, what not to use. I'm not going to listen to him even if he says not to use this. I'm just going to let you know right now because this is the bomb with taking off your makeup, and it will help grow your eyelashes.
When we come back, you're going to see what things are good for your eyes and what are not good for your eyes. We'll be right back.
We'll see you in a little bit.
Okay.
Hey ladies and men, thanks for joining the girls. We are talking about makeup today and how it can affect your eyesight if you wear fake eyelashes or if you use different lotions on your face. Pull out your products now, have them with you because we're going to be looking at some ingredients that can be affecting your eyesight today on the girls.
Yes, our guest is Dr. James Deom.
Thank you.
Aw,
Good to
thank
be
you.
He's
here.
an eye doctor, but
Yes.
we know him as Jimmy because I know you since you were like little. You're
That's
members
right.
of our parish at St. John Bosco.
That's right.
And you have how many brothers and sisters?
I'm one of five. I'm
One
the baby.
of five. You were
Yeah.
the little
You're the
baby.
baby.
Little
and
Jimmy.
we watched you sprout and grow way taller than we are. And we're so proud of you because
Thank
you've
you.
become such a successful eye doctor and you've brought so many great,
Appreciate
wonderful
that.
things to the Hazleton area.
It's good to be here. It really is. It's wonderful, and I'm happy to be here on the show, and I'm happy to be with you guys. And it's good to be here in Hazleton. It's good to be here with our people, right? And it's a really nice opportunity. So thanks for having me.
You're welcome.
Yeah.
You have a wife and you have 1 and almost 2 babies.
That's
coming.
right. Yeah. So we're growing a beautiful
1.5
family,
babies.
and 1.5 here, and due in just a couple months. And man, is it fun! It is just an awesome blessing. I'm just having a blast.
Well, you're always having a blast. When I come in your office, you're always like a breath of fresh air because you come in and you're full of life and liveliness, and you always have great things to do. So recently, as I mentioned before, I came for my normal eye exam.
Right.
And of course, the problem has always been the dry eye.
Sure.
So now what do is you did the eye exam, checked everything out, and I have a quick question to ask you. The eye chart that you have there.
Yeah.
If you have a kid that comes in and studies that eye chart and memorizes it,
Sure.
and they want to breeze through because they don't want glasses,
Sure.
can you look in their eyes and check what their prescription is without them telling you?
Absolutely. Yeah, we have a ton
Oh.
of ways to fake kids out, and you'll be surprised that kids love to come in and malinger. That's the technical term.
Some kids want glasses, so some kids
A lot of them are
fine.
lying. More
Right.
often than not, they're lying. Usually they're not breezing through it, memorizing the chart. Usually they're lying. So, the big E is up there. Anybody could see it. But that we have the big eye chart up there, and then they're, I can't see it. I can't quite make it out. Mom's saying, Joey, come on, and I think, their friend just got glasses and that's what they want. So we do have ways to objectively measure it. But yeah, that's one of the biggest things that we run into on a daily basis.
Okay,
kids,
so
kids lying.
after you did the whole eye exam and whoever established that, then you asked if I had any problem with the dry eye, which I had an ongoing problem. And you brought this little instrument out, which I told everybody on the first segment. So did I make any mistakes telling about
You
this? Or what
were
was it?
spot on. You had an
good.
excellent introduction. Obviously, a very competent eye doctor prescribed that for you.
Yes, he
that was
did.
me.
And
Anyway, so
I've been using it twice a day, as
Wonderful.
you said, and
Wonderful.
it's like part of my morning and evening routine.
yeah.
And I do see a difference, literally see a difference, because
Awesome.
my contacts are more comfortable,
Beautiful.
and I actually have better vision. So
it's a wonderful
okay.
device. It's a natural tear production, and great for somebody who's wearing some makeup. So it's wonderful for women. It is wonderful for men as well. But it's nice because it's all natural. If you do have makeup on, it's not going to mess up your makeup. So
No, it isn't.
No, I don't have any problems. Well,
Yeah.
I haven't gone to the eye doctor this year.
ignorance
yet.
is bliss. But yeah,
Right.
go ahead.
I
Continue.
don't have any problems with my eyes.
Yes.
Yeah.
I'm sure when I make my
Yeah.
appointment, we'll find some. But I have 20/20 vision, which I'm proud of because my mom and my dad and my brother, they both have
Sure.
contacts or have had surgery. So if you do have pretty good vision,
Yeah.
is that a product for you, or why should you still be seen every year by the eye doctor?
Yeah, so I mean, there's definitely lots of reasons why we want to still get you into the eye doctor to make sure that you are not having any signs of anything that could be coming.
Mm-hmm.
Glaucoma is a silent eye condition. Macular degeneration could be silent in the early stages. Looking in the back of the eye is a great way to look for other signs of systemic issues like high blood pressure, heart problems, diabetes, cholesterol, things that are common in many individuals. So, it's just a good thing to do, and definitely a good practice to get into. So,
All right, so I'll make my appointment.
all right.
If you promise that you won't find anything wrong with my eyes.
We're gonna make you
there
20.
we go.
We're gonna make you 20 happy.
I love
yes,
it.
20 happy.
20 happy.
The
Yes.
thing I love the most is no more, if you have a choice, if you want to have your eyes dilated or not, because now you can go and have photos taken of your eye
We have a
instead of
wonderful
having them
technology
dilated.
to
So
take a
that was
picture.
awesome.
Yeah, wonderful
so
technology.
it was a zippity-zippity-doo-dah kind
Okay,
of
so you don't
appointment.
get your
It was
eyes.
great.
I hate putting like drops or anything near my eyes. That's why it's like, ooh. So you don't have to do any of that?
Well, it's I don't like to say don't have to. We get I don't want to be held to the cross for that, because certain eye doctors will say
Yeah.
boy, you really have to get a dilation, and certainly nothing will replace a dilation.
Okay.
But the technology that we have with the camera that we have gets a wonderful photo, and sometimes we need to supplement with dilation. Oftentimes we do, but it is a nice way to supplement.
So you have
the
an
exam.
option.
Well, we
Yeah.
need to mention also that you do have your own show. If people would like to go
We sure
online
do.
and watch all of the shows,
do?
Oh my God.
and watch everything on
On TV?
SSP TV.
I'd be a guest.
You may certainly be a guest,
Oh, wow, you
and I
could
have
be
to
the guinea pig.
I have to say, Dr. Tom Kislin, the founder, medical director, and really, my mentor here
Mm-hmm.
in Hazleton is I have everything to thank to him. So
He's fabulous. We're so
he's a real
grateful.
leader here in on the show, and I just follow the lead, and we've been having a great time. So
Not to mention how
Yeah.
much he does for the community
Huge.
services for sight.
Wonderful,
and
wonderful
really
part of the
educates
community.
the population
absolutely, yeah. So you wanted to talk about makeup?
Yeah.
We want to
So,
talk about makeup.
let's talk about
What we
makeup.
have to do
All right,
is we
let's
have
show
to
some
start
products.
talking about some of the things that we do.
Yeah.
I happen to host a show, as you could see. So what we do for on-air makeup is heavier than what we normally wear
Okay.
for every day.
It looks beautiful,
So we
both of you,
do,
by the way.
thank you.
Yeah.
But we do wear false eyelashes to enhance the eye a little bit. And I asked you about that before. So that's how we got into talking about your coming on the show, because of how dangerous different things are for our
I said,
eyes.
let's talk about that.
All right.
That's
so
an important thing.
What do we want to start talking about?
Do
with?
the
How
eyelashes
about
first.
the eyelashes?
Okay. So very interesting.
Okay.
False eyelashes or eyelash extensions or different things that cause your eyelashes to grow. Very interesting. Couple studies were done that showed that there is a normal lash length
Really?
for people and for all organisms. So what the lashes do is they protect the eyes. They stop bacteria from getting in your eyes. They create a wind barrier. So too long, too short exacerbates all those things.
So they could be too long.
It could be too long, believe it or not. Yeah,
Never. No.
Yes.
You can never have eyelashes too long.
It's true. I'm sorry. It's true. And there's studies that show this. And another thing is this: we're putting it on there with
Glue.
all sorts of nasty stuff.
Read that
Glue.
stuff on the back
Oh
of
my
it.
God, it's.
But what if you're only wearing them for like an hour or two?
This
I think
doesn't
that's-
even have the what's on here in it.
Is
so
it bad
It's
stuff?
so bad for you. They
it's
can't
so
even
bad,
listen.
and it's in another language.
It's
so
glue.
a lot of them are glues. A lot of the other thing is if you're getting the glue on there, what are you using to put it on there? Who's putting
brush.
it on there? It's a breeding ground for bacteria, infections. These glues will break down the
Do you want me to
natural
rip mine
oils.
off right now and scare everyone?
Let's talk about alternatives, because there are number one, we know based on science that there is a normal lid lash length. Okay, so altering it disrupts the normal lid lash length and can really cause some really significant symptoms. Dry eye being the biggest one. So what can you do to avoid that? You have this sort of medieval looking device right over here. I'm going to reach over and grab it.
Medieval?
So maybe you could tell me what this is. I don't even
You don't know what it is?
I'm kidding. I do know. I'm kidding. I do know. Here, let me show you. No, I'm just kidding. I do know what it is.
Why is it this though? Like men, you will see like men's
Sammy
eyelashes
Jr.
will have beautiful eyelashes all long, and women's are all short because we, tamper with them.
It is, and that's a really good point. I don't know if there's ever been research to show the male-female differences, and if it's because of, use of makeup over time, but I would think that that's a very good hypothesis. But using something like this to naturally curl your lashes and accentuate their natural beauty and their natural length is the preferred method.
Okay, well what if they're this long?
So curling them up will allow them to be more prominent.
How about the mascaras? Now we have several kinds of
Mascara
mascaras.
is probably
so
one of
here we
the
go.
worst possible things that you can put on your eyelashes.
Even if
now,
it has good stuff in it, like coconut oil
see-
and lubricants
Right.
and things that promise to make your eyelashes
The biggest
look more
problem with
natural.
eyelashes, mascara, is waterproof. Okay, waterproof mascaras. Why? Because what do you need to do with a waterproof mascara?
It's like lacquer.
How do you get it off?
Varnish.
You use special
this.
stuff.
Use this special
Right?
stuff.
The biggest problem with waterproof mascaras are the inability to remove them. So we use special stuff.
Right.
Don't even put that down.
Enters Dermatologica, which I heard is very good, and it also makes your eyelashes grow longer.
It does.
It's two wonderful things.
Yeah.
So
Jimmy.
a lot,
Little Jimmy's
little
getting-
Jimmy. So a lot of these will have, and I'm going to put up a list here that shows a bunch of different really dangerous chemicals that are in our makeup removers. Things that dry out our natural oils, things that break down our oil-producing glands. There's also something called paraben. Paraben is a product that's in a lot of the waterproofed mascaras.
Sound
It's
like wax.
actually, and it actually has estrogenic properties and alters the meibomian gland structure. So
Oh,
it's
that was a mouthful. My bone.
those are the oil glands
And what
in
does
your
that mean
eyelids.
to the common person
It
for their
means
eyes?
that-
Infection
listen,
or what?
It could mean infection. And here's the thing. And it's interesting how you guys kind of pointed out. I'm fine, everything's cool, I don't mind. I got dry eye. I'm having problems. It's hard being beautiful. It's a lot of work. You gotta put makeup. It's work. You're having issues. You're not. And this is an important point. Maybe you're not going to have issues right now, but we got to think about your eyes 10 years down the road, 20 years down the road,
10 years down the
5 years, 1 or 2 years down the road. And, so this is a preventative approach. It's a prophylactic approach. So yes, you may not be having problems now, but we know these things are dangerous, for your oil producing glands, for your tears, etc. We know that there's many other factors in our lives that cause dry eye. Why add one more?
Right. I was just going to say, I
what's
didn't.
the
I always
alternative,
had
though?
dry eye though,
you
not
s-
even from a lot of makeup from wearing
And
false.
it's maybe not from that, but
From
it certainly
contacts? How about from the
exacerbates it.
contacts?
Certainly contact lenses can exacerbate pre-existing dry eye. Lots of things
The
cause dry eye.
environment.
Different medicines we take. All the antis cause dry eye, antihypertensive, antidepressants, anti-allergy medicines.
How
all
about
those things cause
thyroid
dry eye.
gland?
Thyroid condition can have concomitant dry eye. So lots of things cause it. So you said what's the alternative?
there
What do you do?
other products
there are
out there
definitely
that-
products out there that do not contain all of the list of different things that we mentioned are very harmful for your eyes. So it's not easy. I'll tell you, it's not easy because a lot of them use really savvy marketing to kind of take the attention away from some of these things. Another big offender are preservatives. So a lot of these products are preserved. the percentage of preservative that you can use in a eye drop is like 1/100th what they use in a lot of the makeup removers. So it's a totally different level because it's not regulated the same way that prescriptions and ophthalmic products are, but yet you're putting them in your eye. So,
Right.
you know, it could be very dangerous.
All right, well, we're going to talk about some of the dangers. We have to take a quick break right now.
I'm going to do Jimmy's makeup when we come back.
Yeah, you just make sure that you stay right where you are. Watch the commercials. Make sure that you take a good look at the sponsors of the show, because thanks to them we're on air. And if you could go and check out their places, it would be even greater. Make sure you tell them that the girl sent you. Stay where you are. We'll be right back.
Hey guys, if you're just joining us, we talked earlier about some products that we're going to be using on the show. This is Coco Smile. It's a whitening toothpaste, and we did a Facebook Live. You can go to that, the girls SSPTV, to find out if it really does work. And we have a guest with us. We're not talking about teeth, we're talking about eyes and safety of our vision.
I've been called an eye dentist before, though.
Eye dentist?
Yeah,
All right.
so it's okay.
There you go. I like that. I like that.
I'm not, though.
You're just a superhero, because without my eyes, I wouldn't even be able to see. So that's the best part. But we were talking before about the dangers of eye makeup for your eyes, how to remove it, how to whatever. How about the creams that people use on their eyes too? They're supposed to make your eyes look ageless.
Anti-aging.
So
That's the big word, right?
Is
You
the
see it
big
on
word.
everything.
And some people think that if one little drop is good, maybe half a bottle is better.
Of course, more is better.
And so they're told to put it in around the orbit of the eye, which is here.
Yep.
And then you find them going in here and going in here. So what happens if you put this directly on your eyelid?
Definitely don't want to do that. You want to try to follow the directions, of course, to place it into the area where it's directed to go. Definitely your eyelids are one of the thinnest structures, so you know it can permeate into the structures of the eye. So you want to be careful about the placement. I think
So it gets
the point
absorbed
is
into
good.
your eyeball.
It can. That's one of the thinnest tissues that you have in your entire body. The other thing is that some of these products, even though they do claim to be anti-aging, Botox in a bottle, you've heard all of these things, a lot of them are, of course, dangerous. You know, they don't support good oil production. They don't support good skin health. Retin A, you hear that one a lot. That one's the one that stimulates keratinization or hardening of the skin, even though it will maybe take away some wrinkles. Its long-term effects have been well documented and studied in a negative way. So,
Well, you brought up Botox.
Yeah.
Some people get Botox injected near their eyes. How bad is that for your eyes?
well, you know, there's actually reasons that we do Botox into the eye muscles to help with eye turns, to help with eyelids closing and not opening. To open the eyes. So there's reasons that we'll use it around the eyes,
That
and
they're
it's
indicated for.
pretty harmless. Yeah.
Okay.
So just under direct supervision of a professional, of course. So.
Can you talk about actually washing your face? Because, you know, some people, they wear makeup and they don't wash their face.
Yeah.
Before bed.
Yeah, so definitely one of the biggest problems with eye makeup and mascara and all the other things that we've talked about is the fact that it needs to come off. And removing it is extremely important, getting it off, because it can block the openings of the oil glands and really sit in there and deposit. And if you do that, there's natural bacteria that live on your eye too. So you're basically sealing off that bacteria, which will then grow, potentially cause a significant infection. So getting those makeups off, whatever you have on, very important. Lots of different things you can use. You know, we like, I've got a couple here actually. Avenova is a really good prescription eye wash. This is made to control the bacteria. It lives on your eye. It's very effective at removing makeup as well. And it is very safe even if you got it in your eye. So it's really, really effective. For people that aren't wearing makeup, that's also a good thing. Just clean the eye. There's something called Demodex. You ever heard of Demodex? So Demodex is a skin mite that actually lives in all of us. And for some people, it could cause significant issues. And actually a mixture of tea tree oil in different lid scrubs will help get rid of that. So tea tree oil in lid scrubs is actually really good for the eye. Okay, so that's kind of an interesting thing. Lots of people are into essential oils these days. So, you know, a little drop of tea tree oil in some of the stuff that you use might be good. And there's also a prescription based lid scrub out there called Clearadex that we have at the office that we use that has tea tree oil in it.
So there's like a list that you're showing us of things that if you have your products and you're looking at them and they have these ingredients, is that something they shouldn't use? Or?
Yeah, you know, here's the thing. So it's really difficult to find some makeup or makeup remover that has none of these things in it. They are out there, and I could provide you a list of some of those things. It's more of, you know, hey, are you having a problem? Are you having an allergy? Are your eyes red or irritated? All right, well, let's take a look at what you're using and see what could potentially be harmful. Other issue is, you know, if you're already, you know, potentially going to be a dry eye person, if you're wearing contacts, if you have some of those other factors we talked about, maybe we want to limit some of the things we know could be causing problems down the line.
Oh, we'll have to talk to you near.
Well, I hope we opened your
right.
eyes to a lot of things
like
about
what
the
you did there.
makeup, and I certainly have learned a lot of things from coming for my eye exams, and I've always had a lot of things treated well as well. So
thank you.
I attribute my good vision to the good care at the Hazleton Eye Specialists. You and your staff up there, everybody's so kind.
Thank you.
I'll be
They
in.
accommodate everybody with
Sign
their
up.
appointments.
I'll be in.
I didn't have to
And
wait
I'll-
very long in the waiting room, and I was seen by everybody. Was very nice
Thank
and
you.
quick and in
Appreciate
and out.
that.
And I mean, everybody's time is very valuable, and
Yeah.
you
Yeah.
made it very, very quick, easy, and fun.
I appreciate
You're a lot
that.
of fun
We do.
guy.
We try to
For
have
the
fun.
kids too.
Yeah,
Thank
and
you.
if they have to get new glasses, you have a ton of frames up there.
Oh, yeah.
How about
The
the,
most in the
Jimmy
area.
Choo and all of the designer
Oh yeah,
area?
the best
designer
in the
frames?
area for sure.
Yeah.
Yay. Well,
All right.
thanks. I want to do your makeup too for Facebook.
I'd be happy
Yeah,
to
let's
do it.
do it. Let me come over
Keep it
here.
up.
As we
What?
go off
Night.
as we go off and say goodnight.
All right, guys. Thanks for joining us on The Girls.
Sparkles.
We'll see you next time.